Hello and welcome to Success is Never Accidental. I'm Lynn Payton and I'm passionate about helping individuals and organizations to get better results. And on this podcast, I get to interview some highly successful people so that we can see that there are many common elements to success, and we can listen to our guests and identify what their formula was. So although success is a very unique concept to each individual, we can see that there are many common factors. My guest today, Dr. Raul Mercer, is a pediatrician and public health specialist based in Argentina, but with a very distinguished international career focused on advancing children's health and children's rights. Raul has held senior leadership roles across Argentina's health system, including serving as the Director of Maternal and Child Health for the Buenos Aires province. He currently coordinates the Social Sciences and Health Programme at Flaxo in Argentina, and he represents the UNESCO Chair in Global Health and Education nationally. But perhaps most significantly, Dr. Mercer leads major international collaborations, including the CAP, Children in All Policies, a programme aimed at ensuring that children have a say in all policy initiatives, and the EPIC project, working with partners such as University College London and the Centre for Learning for Childhood Development in Ghana, in order to strengthen intersectoral approaches to child wellbeing. And these international projects are having absolutely incredible impact. Raul's a recognised advocate for children's rights and represents the Latin American region for the International Society of Social Pediatrics and Child Health. And more importantly, he contributes to global thought leadership through initiatives such as the World Health Organization, UNICEF, Lancet Commission 2020 on the future of the world's children, and also in UNICEF's Growing with Rights 2026. So help me welcome Dr. Raul Mercer. Raul, it is so good to see you again. Thank you so much for joining us.
Thank you. Thank you for having me. And it's our second meeting in our lives.
Isn't it wonderful, the value of relationships? Our mutual friend introduced us so we could meet for dinner when I was recently in Buenos Aires.
Yes. And we should mention our common friend.
Oh, why not? You go ahead. You tell everybody about our wonderful friend.
Well, her name is Shoban. I don't know if the pronunciation is fine or not. Fitzpatrick. And I met her for the first time in a meeting that we had in Yale University. And it was about the group that we're going to talk about. This is an international network on peace building and early child development. So I had the opportunity to discover a unique person, a unique woman, a unique partner, because we share the same interests, the same feelings and goals. Unfortunately, we keep in contact after that meeting, working together as we are going to talk about. And then when she realized that you were going to come to Argentina with your husband, she mentioned, okay, let's take this opportunity and let's see if we can join there in Buenos Aires. And when you call me, I answer immediately yes, because there is no room to say no to Shoban. So, and for me, it was also a very nice experience, because just going without knowing who are you're going to meet and who she is. And so we have a wonderful dinner, and it was a good way to update our lives, to know about each other, and to see what do we have in common between Ireland and Argentina.
And isn't it interesting, because we find so many things in common, because as you said, when your feelings are the same, your goals are the same, and your values are the same, then it's always easy to find connection and to find ways of doing business together. I'm going to correct the pronunciation for all of our listeners. Raul's pronunciation was a little bit off. We were talking about Siobhan Fitzpatrick, CBE, and incredible champion of children's rights in Ireland and internationally and globally. So, Raul, let's talk a little bit about your career path. So you're a pediatrician, you're highly involved in national and international work. How did your interest in policy development for children's health and indeed children's rights emerge? Tell us a little bit about how you got there.
Well, as you mentioned, my background is as a pediatrician, and I spent significant years of my life working on a clinical basis in hospitals, intensive neonatal care units, in primary health care. And after going through the career, I started to discover many aspects that were not approached during my undergraduate stage of my life. So I found, for example, that many problems that affected children and their families were not related specifically with the healthcare system, and many of those problems could be prevented or could be approached using an upstream approach. And traditionally in our countries, I'm speaking about the Latin American and speaking about the global South, unfortunately, the strength of our institutional system that involves many stakeholders, not only health, but also education, social development, social affairs, transportation, environmental issues, they're not working together, and we are paying the cost of this fragmentation. So based on this particular situation, I decided to extend or to enlarge my office because I thought that using only clinical approaches, it was not enough to understand the complexity of health. And health is a value extremely complex to be only based on the hands of us, the physicians, because this is a very complex social construct that involves different ways of understanding how the context factors are interrelated. The so-called social determinants of health are related. This concept of social determinants of health are now expanded into political determinants of health, commercial determinants of health. So all those factors, they are interrelated. So after working as almost 20 years as a clinical pediatrician, and after, I have to be honest with you, and after having also conflicts with my own profession, just confronting situations that were not aligned with the sense of what we consider a child. And from my perspective, the child should be and has to be a subject of rights and not a merchandise or an object. And the way as practitioners of the society itself, sometimes this relation is not clearly established. We use sometimes the profession as a way just to get profit, but not as a way to make a significant contribution to the child itself, to their families and the society. So after this brief introduction, I talked to my wife. Unfortunately, she's not anymore with me in those times, to have an experience abroad and to go to study public health, epidemiology, and just to expand the way to approach health involving other disciplines like sociology, anthropology, economics, evaluation of technologies, and of course, trying to absorb different disciplines that are not part of the medical career or the medical curriculum. And for us as a family, it was a refreshing experience. It was in the United States, in the Midwest, in a very unique city that is Madison, Wisconsin, in the Midwest. And it was a very cultural, refreshing experience, learning from our colleagues and our classmates, and then having the opportunity to graduate and to get my master's degree in that university. And we spent 2 years living there with our 2 daughters, and then we decided to come back. And coming back to Argentina was not easy. It was much easier to leave Argentina and go to the States than to come back. But it was at least my purpose to come back and to see the way to try to give back what I got during my stage in the US when we went back to Argentina. And the only
So
possibility.
they're all very different cultures coming from Argentina, and you shared with me some of the experiences of living in Argentina through different regimes, and even nowadays with such high inflation, to going to Wisconsin. What was the biggest thing, the biggest learning, or the biggest insight that you brought back with you when you returned to Argentina?
Perhaps one of the things I could learn is the importance to work in a collaborative manner, to learn from each other, to understand the importance of intercultural issues, to be respectful from each other, and also to understand that we are permanently in movement. We are in a very dynamic process that sometimes from our institutions, there is a huge delay in terms of trying to respond to social change, to those things that are affecting people. And just getting all those tools to try to understand reality and the dynamics of the process of the social processes was, I think, was of the main learnings that we could get. And another thing is that I could discover the worth of public health in the United States, because traditionally, us from Latin America, we used to envision or to visualize the U.S. medical system in terms of high technology, high complexity, private sector, apparatology, high technology. But this is not the case. There's a huge movement of public health movement in the US that is extremely powerful scientifically and politically. Unfortunately, at those times, we didn't have any public health movement in Argentina. Nowadays, we have a public health society, but in those times, we didn't have. And this is a key issue in terms of how to strengthen the public health perspective into the health view.
So when you came back, you and your family came back to Argentina, there'd been a massive shift in you personally and in your family. And then you came back and you had to reintegrate into Argentina, but with a different mission. So what happened next?
Well, I had to get a job from the very, very beginning, knocking the door and asking to get a job. And after arriving from the United States, I decided to go to a very poor neighborhood of a municipality of the peri-urban area of Buenos Aires City, extremely poor. I think that there were not too many cases of people coming from the US and going to poor and deserved areas. But based on my training and my skills, I decided that going to that place was a good decision. And of course, I worked there, and it was a dream, it was something unbelievable, how many things we could do in those times. But part of the Argentinian history is that we have turmoils, we have conflicts, we have tensions, political tensions. And after working almost 2 years in that municipality, there was a political turmoil. And my boss, the person who hired me, he was fired, and I decided to give up because this was not the project that I wanted to be part of. So then I decided to move from the municipal level to the province level, and I became the head of the maternal and child health program of the Buenos Aires province. That is almost 40% of the total population of Argentina. So then I expanded also my scenario, working with all the province and creating teams and trying to train people in different parts of zones and regions of the province. And then we started to move the wheel in terms of how to introduce technology, science, knowledge, participation integration of interdisciplinary teams into one goal. And that goal was, in those times, was to reduce child mortality, maternal mortality. Nowadays, the situation has improved, fortunately, and we are now moving from the paradigm of survival into the paradigm of thrive or early child development. So this was a totally different experience, and that was the first time that I had the opportunity to introduce child rights into the program of the Ministry of Health.
So looking back at that time, because that was a huge program, what were some of the things that you were most proud of?
Well, first was the freedom to feel, to work in an enabling environment. There were no political restrictions. There were no technical restrictions. Of course, there were financial restrictions because you don't have the possibility to have unlimited funding. But considering the situation of the province, we could make many changes, introducing different perspectives and ways to approach health. So we considered that it was important to consider health from a life course perspective, and understanding that when we start to analyze the situation of children, we also need to consider the situation of their mothers. So the idea was to integrate women's health and child health. So not only from the biological point of view, but also from the rights perspective. Because we know that in one study that in one research study that we made here in Argentina, is that almost 50% of the women that become mothers, these pregnancies are the result of an unwanted and undesired decision. Mm-hmm. So we consider that we had to provide the means for those women to become pregnant when they want, and not as a result of a sexual violation or an abuse, or this is the case of a young adolescent of less than 14 years of age. So these situations also should be considered as part of the life course of the reproductive process. Mm-hmm. So we started to introduce this perspective, and we also introduced the perspective of rights, considering that we in Argentina, in most of Latin American countries, we learn rights after the systematic violations during the military or dictatorships. Mm-hmm. So we consider that this time was a good time to start to learn about rights, but from the promotion of rights and not from the violation of rights. So this is a totally different way. And we understand that this is a humble way to consider on the contribution that each sector can provide to strengthen the democracy. If you ask me, Lynn, how long does it take a human pregnancy, I can answer you. But if you ask me how long does it take to the gestational period of a democracy, I have no idea. We are in process, and it's going to take a long time. So this was our humble contribution in terms of bringing rights to real life and make things happen, because each subsector of the society is co-responsible to promote rights. And another issue that we also introduce is the gender perspective, considering that first, gender is not a women's issue. I'm speaking as a man. Mm-hmm. I understand that gender is not a confrontational issue, it's a relational issue. So we have some role in this complex process of relationship between men and women, and that this relational approach doesn't start when we are grown-up people. We have to understand how gender is built as a social psychological construct since early stages of life. So in my case, as a pediatrician, I understand that gender also is an important dimension to be included when we consider child health, when we consider rearing practices at home, when we consider education practices, and also how, as a society and adults, we consider children, boys and girls, based on the adult perspective and not based on their needs.
I want to just take a moment to just like let all those important things that you've said, Raul, just to let them land, because your approach has been very reality-based. It's very contextual. It's very rooted in the social, political climate of where Argentina was at the various phases. You clearly learned how to influence, and we influence people when we know what already influences them. So you've been very effective because you knew how to work within those complex systems. And you also talked about collaboration across social circumstances, across education, across politics and whatnot. And you also said, we don't know how long it's going to take to evolve, but we have to keep doing a little bit more and a little bit more and a little bit more. And then when we build that network, will that help us move a little bit faster? And I just think everything you've said is so real. And I loved one of your why you loved the work was because you were in an enabling environment and you talked about teams. Say a little bit more about how leaders can create an enabling environment where teams can actually get the best out of each other.
Well, it's not my invention. It highly demonstrated and is in research and is in science that creating enabling environments is good for people, is good for health, is good for quality of life. And what we know is that sometimes restrictions that are imposed by, for example, rearing practices at home, having parents that are extremely strict or violent in the way they establish limits, or restrictions imposed by the kind of society that we are dealing with in terms of living in very fragmented societies, discriminatory societies, racist societies. This affects also health. We know that any person that is discriminated for any reason, this is bad for health. So from my perspective as a physician, discriminate people is bad for health, and this affects people in different ways, and any kind of discrimination. But unfortunately, our societies are very clever and very innovative in developing new ways of discrimination, although we have huge evidence that discrimination is not good for people. And this situation can be also extended at the political level. So these kind of restrictions can affect when you live in autocratic governments, under autocratic governments or dictatorships, or in areas of conflict. Nowadays, we are paying the cost of this bizarre situation that we don't know if our planet is going to exist tomorrow. So this is unbelievable. So all this situation of they influence in one way or another the possibilities of the people to expand or to express their own potential, their own capacity. I had the opportunity to work with a colleague of mine who is a professor at UCL, University College of London, and he worked many years of his scientific life in the field of women's groups. And so he started to study the importance of creating enabling environments to facilitate people to develop their capacities, to become more useful peoples, to be more integrated to the societies, to be more healthy, to have more life expectancy. Actually, If you allow me, I will show you the book that he published.
The Social Edge
Correct.
by Anthony Costello.
Perfect. And this is about all his experience working with sympathy groups in terms of promoting change. And he doesn't talk about making a revolution, just thinking of your everyday life and watching and having the clarity to identify those groups based on the different purposes. Are you going to play music? Are you going to play sports? Are you going to create a health team or educational team? Just thinking what's your goal, and then to find the right people and to have a common goal, a common sense in your life, and they to work together without competing to each other, just working together. And what is interesting from Anthony is that he brings science to reality, and he transmits his experience into real life. And for me, as a humble practitioner, I take this experience as a reference on how this concept can be applied into different dimensions or fields of your expertise. Just for your information, Anthony was the head of the maternal and child health unit at WHO, the World Health Organization. So he's a very high reference person in the scientific world, and had also the possibility to work in a commission, the Lancet Commission, UNICEF, and WHO, trying to answer a future for our children's world. What kind of world are we creating for the future of our children? So based on, yes.
Sorry. I was going to say that was a massive piece of work in 2020, the World Health Organization, Lancet, UNICEF work. And it really mapped out a vision for children going forward for the next 10 years. But so you moved from having a national role in Argentina, and then having had some experience working elsewhere, you became more interested in the potential of working internationally, Ralph. So tell us about some of those amazing initiatives.
Well, the reason why I had to extend the borders of my life is partly because the circumstances. Just for your information, and keep this among us, this is a secret.
Just a secret for this podcast.
Yes, no one knows. I was fired many times. Yes. I was fired almost 3-4 times in my life. And this part of your contingencies, when you have to work for the government, and you are exposed to the different changes that happen on every changes in the administration. Mm-hmm. So these are the rules, and I cannot question this, how it works. And perhaps this is a difference also with the Northern Hemisphere countries, when you can get more continuity, more stability in your work, but this is not the case in our countries. So part of the decision to extend my borders was that I lost my job. So then I started to work in Latin America, in the Caribbean, in Europe, in South Africa. So this was the good part of the story, is that I could see beyond the borders. Mm-hmm. The other reason is that when you work on rights, by definition, rights are universal. So when we speak about child rights, there are no borders. Every child is important, independently on where he or she lives, the socioeconomic status, the language, the religion, the sexual orientation, the gender orientation, doesn't matter. We are all human beings. And this was a key issue to try to understand why it's important to work on child rights everywhere, with some exceptions. I mean, just as you might know, the United States is the only country that didn't sign the Convention of the Rights of the Child. But fortunately, many people in that country, they are starting to understand why it's important to introduce a child rights perspective. For you, as someone coming from Ireland, is obvious because it's part of your history. We are talking about countries with a strong democracy, with strong history, and also, I would say, is a child-centered country. I'm totally healthy speaking. I'm very envious of Ireland in terms of the changes that you are making, the kind of policies that you are developing. And this was part of our conversation when we met in that dinner. And of course, what you are doing is extremely important also to export to other countries and to learn from what your experience.
So what do you see, because you are involved in that major global initiative, what do you see are the biggest threats to children's rights, health, well-being, as we are here now in 2026, in a very difficult time internationally?
Well, of course, now the situation of the world is unstable. What we showed in our publication, that is the result of 2 years of research and working together, nearly 50 professionals from all over the world, is the major two threats that children have nowadays are first, the climate crisis, and second, the commercial determinants. Well, these factors, both the commercial factors and the climate change, they are interrelated, they are not separated. And actually, we used to speak about polycrisis in the sense that there are many crises happening nowadays, and all those crises that include climate change, that include commercial factors, that include armed conflicts, they are all interrelated. So, of course, nowadays the armed conflicts is a key issue. Armed conflicts affect health in many ways, affecting not only the present but the future of the children who are living in those areas. So you cannot only evaluate the consequences of a war, counting how many people pass away. Those children that are playing in the former houses, because they are totally destroyed, and although they are playing, they are not healthy children because they are some problems in their minds, in their bodies, in their biology, in their development that will affect not only the long term of their lives, the future of these children, but also the intergenerational generations. I mean, I'm sorry for repeating, but the coming generations will also be affected. Yeah. And people that are now managing the decisions, they're not conscious of the cost that this will have on the children themselves, but also on the global society. So as you can see, we are in a very, very, very complicated and complex scenario where children are not in the center. They are not part of the policy-making process because children do not have power. Yeah. They are not violent, and also the interest, they go on a different way. Yeah. And that way is marked by power, by political power, by economic power. So as you can imagine, the children are not part of this business, so they are marginalized, and they're paying the cost of the decision of adults.
And the work that you referred to earlier, that you work with Siobhan Fitzpatrick, others, and Dr. Ali, who I had the great pleasure of interviewing recently from the West Bank, the International Network on Peace Building Among Young Children is really trying to bring awareness to all of the things you've just talked about, but beyond that, to actually have active projects and media initiatives that help children have respect for each other, the respect for difference, respect for different cultures, religion, and help children to do what sometimes adults can't do, which is celebrate diversity and difference.
I agree with you. And talking about Shoban and Ali, these two unique people, because are really unique, they're investing their lives in terms of getting a better future. Shoban, after her experience in the Irish conflict and just contributing in the healing process of the society. So she had experience and she had real words coming from the field of what can be done. And also she brings hope in terms of knowing that after the conflict, we have at least some hope to build a better society.
And I think hope is so critically important, isn't it, Raul? We have to have hope that there will be, that all of these initiatives are paying dividends. And we know from the research evidence that while there is so much more to do, we know that so much good work is having an impact. Going back to, you talked about earlier, moving from survival to progress. Say a little bit about the work that you're doing with the London College and with the Child Development College in Ghana, because that work is really making a difference in terms of real survival rates, isn't it?
Correct. But before making a comment based on your question, just I want to make a special comment on Ali. May I?
Yes, please do.
Well, I met Ali in that meeting in Yale, and he introduced himself as a physician, as a person from the West Bank, and all the working in terms of the promotion of early child development and child health. And he also expressed his pain based on the experiences, life experiences he has to deal with living in that area of the world with so much pressure with the conflict with the Israeli military forces. When I listened to him, I told to Ali, well, I must tell you the truth. Although I'm coming from Argentina, I'm coming from a Jewish family. My two parents were buried in Israel and I have a brother there. So I want to express my pain listening to you, because he speaks with pain. He doesn't speak with a sense of revenge. He doesn't speak with a discourse against Jewish people. He's a very humble and very intelligent person. So, and we had the possibility to talk to each other, to watch to each other our eyes, including one colleague from Israel. So what I found in that meeting is that we can have these spaces for mutual understanding. Why cannot we expand the effort that this network is doing on other parts of the world? So for me, Ali is a unique person. We keep in touch, and I think that we have to strengthen this work that we are doing with Shoban, Ali, and many other colleagues. And going back to your question, as a result of the Lancet report, there was a new initiative has been developed with the name of CAP 2030. CAP 2030 means children in all policies. So one way to reposition children in the center of the policymaking process. So this is not a medical-oriented project, it's a health-oriented. So when we talk about health, we are talking about many sectors and actors of the society that are involved in the building process of health and quality of life. The decision to invite two different countries, one from Africa, Ghana, and one from Latin America, Argentina, is based on the perspective of the South-to-South collaboration. So, although Ghana and Argentina are different in terms of their history, their cultural background, their location, we share a common issue: children. So, as I mentioned before, children are the same independently on where based. So based on this idea, we started to work together with coordination, scientific and coordination of the University College of London, trying to understand why intersectoral approach is important to maximize and to coordinate or to optimize all the contribution that the society is making, not only from the government point of view, but also from the civil society and the private sector, integrating all these efforts into a final goal, that is improve the quality of life of children and their families. This is something obvious, probably for you coming from the global north, but we have a lot to learn in our region based on the lack of continuity of the democracies. So you have to learn this process as part of the strengthening process of our democracies, and also trying to promote citizenship from since early stages of life. Although children do not vote yet, they are extremely important to express their voices and also to pay attention to what they want to tell us.
Super. And of course, in Ireland for many years, we've had a children's Dáil, a children's parliament, and lots of initiatives where children are able to have a say. So it's so important that that work is continued in other countries. But as we draw our interview to a close, and I'm so grateful to you, Raul, for spending time with me today. What's one thing that you would say to encourage people who are interested in children's health, children's well-being, and children's rights? If there was a word of encouragement for people wherever they are, whatever their circumstances, what would that be?
Okay, first of all, I want to thank you for having this opportunity to meet you again and to let you know that I would love to meet you again here in Argentina or somewhere.
Or in Ireland.
Or in Ireland. This is the first comment. The second, in terms of making a suggestion or a comment to other people, I think that it is important to recognize ownership of our own lives in terms of how to build our own life trajectories with ownership, with autonomy, with agency. And in this sense, just I want to add two other readings for your audience.
Sure.
The first is this unique book,
Successful Societies by Peter Hall and Michel Lamont.
Yes.
Super.
And this has been developed by the Canadian Institute of Advanced Research. Mm-hmm. And the sense of this book was to try to answer on how institutions and culture affect health. So in one word, what the authors wanted is just to recognize that successful, although it's not by chance, yes, is not a personal issue. I think that we need to understand success as a community, as a social, as a public endeavor. Mm-hmm. So we have to think beyond our personal interest and beyond individualism. And this excellent book provides all the evidence on how health is built and how health is extremely interrelated with policies, with programs, with practices. So the idea is how to integrate and try to move beyond the box. So the first comment to our audience is just to think beyond and to understand that we are not alone and we need to work together. And the second reading, that is something that I have published 1 month ago, is a publication by UNICEF that is entitled Growing with Rights.
Yes, Growing with Rights.
Growing with Rights you can check in the Google and download from the Innocenti web page, that is the Center for Research for UNICEF in Italy, in Florence.
Okay.
And this is a new edition of the original publication that has been published in 2005 by the coordination of Jerison Lansdowne, who is an expert in child rights from the United Kingdom.
Yes,
Unfortunately, she invited a group of professionals and had the honor to be part of this group to try to analyze what happened in the last 20 years in terms of the evolving capacities of the child, how the context affects children, how the families are affecting children, how the conflicts, not only at the family level, but the wars are affecting children, the new digital technologies, the education process, and what can we learn from neurosciences. So perhaps the comment or recommendation is to try to understand that we are living in an evolving world, and children are part of this evolving context, and they are the sort of mirror of all the situations that are affecting children. And we have to keep our eyes open to be aware of all these changes and to prevent all the adversities that children are in some way going through, mostly caused by the adult society. So this is a way to reflect all together and to try to answer the best way to get a better world for our children.
Raul Mercer, you are an inspiration in terms of your vision, your passion for the work that you do. It's so reality oriented, and yet there's that huge commitment, sense of purpose running through everything you do. And above all, hope that by working together, we'll all do a little bit. That shout out to everyone to do a little bit more, to go beyond what they're currently doing and thinking. Thank you, my friend, for spending so much time with us tonight and for all your wisdom.
Thank you, you too.
Oh my goodness, there were so many points of wisdom in that. And I know I always say I want to make the summary short, but bear with me because today's is going to be longer, but it is so important. So Raul talked about the power of groups and teams and networks of like-minded people in getting things done. Whatever role we are in, whether it's in health, education, industry, politics, everything is interconnected, and as leaders, we have a responsibility to see the bigger picture and to think outside the box. There are so many opportunities to expand our horizons and to collaborate nationally and internationally. So just say yes and get more involved. He said collaboration starts with respect for different cultures, for different races, professions, gender, and ideology. Raul talked about the positive benefits of working in an enabling environment, and then he talked about the converse, the negative physical, emotional, and psychological impact of living and working in restrictive and controlling environments. That's a huge message for all leaders. How do you make your environment more enabling? Raul's extensive involvement in international research and international networks is all geared towards ensuring universal children's rights as set out in the UN Convention on the Rights of the Child. And the status in different countries across the world is very different, but the goal is for full adaptation and implementation of all children's rights. Raul paid tribute to his colleagues, Dr. Ali Grass and Dr. Siobhan Fitzpatrick of the International Network on Peace Building Among Young Children. Fabulous organisation doing amazing work in many areas where there is conflict. The Children in All Policies Initiative, CAP, is again geared towards giving all children a voice. And then I asked her, Dr. Raul, what advice would he give to to people generally and professionals in particular. And he said, take ownership of your own life first. Step outside your comfort zone and work with a community of your colleagues to be a positive influence in our ever evolving dynamic world. So, my challenge for you is reflecting on your own impact. Where else can you make a difference? So, I want you to commit to reaching out to just two people this week and have a conversation about how else you could involve children in policy making in your agency, in your community, in your sports club, in your business. And remember, success is never accidental. It's passionate people like Dr. Raul Mercer with vision, passion, focus, and commitment that change lives.